My name is Ioannis Goutos. I'm a consultant plastic surgeon, and both my NHS and private practice is based in London. My areas of expertise include burn care, scar management, as well as body contouring. If you would like to arrange a consultation, please feel free to get in touch. Thigh lift surgery aims to improve the contours of the lower part of the body by removing excess skin and fat from the thigh area. As we get older or after significant weight loss, skin in the thigh area can become loose and saggy and form either vertical, oblique or transverse rolls. Most of the patients that I see in my practice are candidates for what we call a medial thigh lift, whereby we remove excess skin and fat from the inner part of the thigh. There is a discrete proportion of patients who have excess on the outside part of the thigh, in which case they might be candidates for a lateral thigh lift. A thigh lift operation is performed either under a general anesthetic or sedation. Before the operation, the surgeon will mark the areas of skin excess and will ensure that equal amounts are removed from both sides. The operation proceeds through an incision that starts from the groin and goes all the way down to the knee and can be either straight, oblique or T-shaped. Following the removal of the excess skin and fat, the tissues are redraped in order to restore a more natural contour, and occasionally liposuction is used in order to further sculpt the area. A thigh lift typically takes 1.5 to 2 hours, depending on whether liposuction is used. Occasionally, thigh lifts are combined with other procedures, for example, lower lateral body lift, which will undoubtedly prolong the duration of the operation. Following a thigh lift, you may find that activities that involve sitting or bending might be uncomfortable, and it is very important that you avoid placing stress on the healing wounds. It is recommended that you wear a compressive garment for 6 to 8 weeks in order to minimize swelling in the thigh area. Also, I recommend that my patients avoid undertaking any vigorous exercise during that period in order to ensure optimal healing and the best scar quality. Any procedure involving a skin incision will result in scarring. There are a number of steps that your surgeon can take in order to improve the quality of the scars that you end up with. This includes meticulous planning and placement of the incisions respecting the natural creases in the skin, closure of the wound with appropriate tension relieving measures, and good aftercare following your operation. If you are at particularly high risk for developing unfavorable scars, there are a number of adjuncts that I incorporate in my postoperative plan, and these include the use of silicone, steroid tape, as well as needling techniques.